I'll help you access various resources, including those that might be eligible for social services, whether it's Medicaid, a different health plan, a different doctor, a different opportunity to say it's time to have a consultation with someone else. It's time to stand up to your insurance company. It's time to get a different drug plan. And I can help you navigate some of those things. I'm not an expert in everything. I have experts at my fingertips, including all of you. I'm here for you and your family, and we are here to have this together. I'm here to help you every step of the way I create an individual action plan and an individual plan of care. I'm not here to have somebody as a client for the next 10 years and just to say, I don't bill on a monthly basis. I bill on a monthly basis, but I don't charge on a monthly basis. I only charge if there is something that I'm doing. So I create the plan of care. Is it long-term care insurance? Are you living in San Diego and your mom is here? Are you living in Atlanta, Georgia, and your parents live here in Island Heights? I'm here to work on your behalf. I ask a lot of questions first, and first few questions I ask, do you have a healthcare representative? And they sort of look. First thing I really get is a HIPAA. I need to have permission from you to talk to the doctors, to talk to the lawyers, to talk to everybody. You have to have 2 people on your healthcare representative. And for those of you that have kids that are 16 years and older, believe it or not, as the doctor said to us, our daughter had Lyme disease at that time, she could make her own decision. She was 16. Well, I went ballistics. I said, not my daughter. This is too serious. You want to hook her up to an IV and this and that. But legally, 16 and older, you get them to sign a HIPAA for you, especially when they go off to college. You make sure you have that permission in hand before you sign over a penny of tuition. You make sure you get that paperwork that the school can talk to you, because once they walk in that door, you're a non-entity. And my husband stood there and said, I'm freighting the bill. And they said, he's the student. She's the student in our case. So I attend physician appointments. I ask questions. I don't let the doctor out the door. And they get up, they look at their watch. Okay, thank you. I said, come on back. Come on back, we're not finished. We have questions. Sit down. That was one neurologist in Toms River with a stroke patient. I go back the second time with a different one. And he looks, you could tell him, here she is again. So with that, we sit down. He gets ready to get up. He looks at me. I said, we're not finished yet. And then the third one I went in with, he said, I guess we're not finished yet. And I said, no, you're not. He said, what else? And I said, well, he said, okay. He said, I'm a hugger. So he says to by the end, and if they're not a hugger, you have the right to find another doctor. I'll assist you in obtaining important documents. I'll help you get your elimination days done if you have long-term care. That is so important. There are anywhere from 30 to 100 days of elimination. And if you know anyone with long-term care, remember, if you have 2 units on the same day, if you have OT and PT, or OT, PT, and a nurse, that's 3. But guess how many days that's going to be counted? Only as 1. So if you have somebody going for long-term care, spread it out. PT, OT, the nurse, home care. Spread it out. They only have to be there 45 minutes. Spread out those days. I evaluate the safety in the home. I actually help organize the bookkeeping as well, because I do have several with cognitive memory decline, dementias, Alzheimer's, and I can still do it myself. And that bill is sitting up there. And I went in with one, and I said, oh, this looks like they're about to put a tax lien on this house. Oh, does that hurt? I said, it can. When you're talking. So I wrote a check, I ran down to the town hall, and I did pay it. I can help on organizing all of that with you. I assist with transitions, such as saying, my mom couldn't get home. I just had a call the other day from somebody who lives in Toms River. His mom lives in Scotch Plains. I want to get her here. She didn't remember where she was. She was lucky enough, she pulled into a gas station. She remembered her husband always pulled into, you kids don't remember, but you could pull into a gas station and say, I'm looking for Oak Street. You know where it is? Oh, sure, it's 3 blocks over and 2 blocks down. But she pulled into a gas station and someone did call the police and looked and drove her home. So it does become, your heart goes pounding. Care is complex across the board. There's so much. And I don't care who you are, everybody's family is dysfunctional at some point. It's an accepted fact. It's an accepted fact. We have in-laws, we have parents, we have kids. We have kids who have friends that we're not necessarily in favor of having them visit with them. So again, you need a treatment plan. You need a plan of action. You have to figure out where their money is. And some of these are the hardest conversations you will ever have. You're the one that someone is talking about. Confused, speak up, ask questions. Be a pain in the ass. There is printed material. You can probably almost everybody uses a computer. You can Google. You can put symptoms. It gets dangerous, but you can put symptoms in online. Come up with a tentative diagnosis for yourself. And my favorite one, which I did not put on here, the guy is sitting on the exam table, and the doctor comes in, and he says, why are you here? He said, I want you to confirm my diagnosis. But at least it gives you a starting point, because if they say there's nothing wrong, you know your body better than anyone else does. You know, my gut hurts, there's nothing wrong. But there's something wrong. So don't stop. You have the right to see a licensed medical doctor, unless you make the appointment with the nurse practitioner. Your insurance company is paying for that medical doctor. So if you come in, they send the nurse and they send an MA in first. The medical assistant takes the vitals and all that stuff. And then if they send the nurse in and say the doctor's too busy, my insurance is not going to pay that. The first visit, you have the right to see a medical doctor. That's what you're paying for, those years of schooling, and hopefully you only see a board certified specialist in your field. And ask for a second opinion. You can fight insurance companies. So, this is Stevie and her twin. Your mother nudge. I'll stand beside you to assist you. I'll stand behind you to prop you up. I'll stand in front of you to protect you. And I do stand in front of quite a few of my people these days. And I'll be your personal mother nudge, but you have to figure out which one's me. These are some of my affiliations. I'm most proud, quite frankly, of a certified board certification for my patient advocacy. It was a wicked exam, and it really was tough. So I'm just so pleased that I did it. National, and also a certified dementia practitioner. And these are some of my favorites, associations. And this is who I am. And there's so many in here. I'm so proud of knowing y'all. In just an extra 2 seconds, if I may, way back when, and I talked about the evolution of your careers, way back when, starting in 77 to 89, I did have a business here in Ocean County, and I was a member of the Toms River Chamber, and I was on the board of directors at that point from about 1979 to 82 or 83 or so. But it is an important part of your life, and again, take everything you learn every day and build on it, and ask questions, and don't be afraid to reach out to someone else, because as I'm looking here, I'm seeing the interweaving of your careers, and you'll never know. Just don't stop working. That's the whole thing. You'll always have time to play golf, go swimming, go fishing, do whatever you want, but don't stop working. Keep your mind going. The POLST and your advanced directive, very important. That's your healthcare representative. Your power of attorney, make sure there are 2 people on the power of attorney. And you make sure you know the power of attorney terminates on death. So you have got to have a will. And you make sure there are 2 people on the will. And if you're saying, oh, my kids don't get along, they're going to squabble, then you go to your lawyer, either an elder care attorney or one of your people, and what you do is you say to them, I want you to find somebody to be my advocate, to be my executor. I want somebody else. I don't want my family involved. And then they'll get somebody that'll do it. It is fee for service. You do it, you get the bank to do the trust or whatever it is that you need done. But don't just let it go. This is called the POLST if anyone wants it. Oh, and you should always have your advance directive, which is what you tell the EMT when he comes in your door. You go, oh, do you have a healthcare representative? Yes. Where's the paper? My daughter has it and she's in Connecticut. It's in my lingerie drawer. They're not gonna wait. Do you want chest compression? Do you want intubation? Do you want a feeding tube? And it should be in a Ziploc bag on the side of your refrigerator for everybody. This is a short, fast, and sweet one. It's called a POLST. And you keep this. And the very first thing says, what are your wishes? What are my 5 wishes if an EMT comes into my house? Do I want somebody to be active, keep me moving, keep me alive? Yes. If there's any indication that I'm not gonna make it, forget it. So anyway, I have this, I put the other stuff on the table. Thank you all, and I probably